Hello and welcome to my channel. This is Dr. Victoria Givens, your board-certified facial plastic surgeon and owner of Givens Facial Plastic Surgery in Austin, Texas. Today I'm talking about the benefits of and if you are an ideal candidate for a rhinoplasty. So stay tuned to find out everything you need to know, and don't forget to hit that subscribe button and like below. Let's get going. All right, so here we go with the topic of the day, if a rhinoplasty is right for you. Now, a rhinoplasty is the gold standard treatment for improving nasal form and function. It is a surgical procedure that utilizes a series of well-hidden incisions to enhance the appearance of the nose and correct issues with breathing. You may be thinking, sure, she said it can enhance my nose, but what does that actually mean? And am I a good candidate for this procedure? Well, let's do a deep dive into the benefits of a rhinoplasty by looking at the issues this procedure can address. Number one, a nose that is too large, too small, too wide, too narrow, or too long. The overall shape and structure of the nose should fit your face. It should not be modeled exactly after another person, because no two noses are the same. And while significant and confidence-boosting changes can be made with a rhinoplasty, the degree of change is dependent on the available canvas, i.e. you. Number two, a nasal bridge that is too high or too low. The nasal bridge is the sloped, firm portion of your nose. It's where your glasses or sunglasses rest. In some cases, the nasal bridge is set too low or deep, making the forehead appear more prominent or the nose appear overly long, and vice versa for a bridge that is a bit too high. Changing the nasal bridge position can ultimately achieve more facial balance. Number three, a nasal hump. This is by far what keeps the rhinoplasty market in business. It is the most common request when it comes to rhinoplasty procedures. Patients will often say, please remove my hump, or even, I don't mind the hump entirely, but I want it smaller. Humps and bumps are usually a combination of excess bone and cartilage from the underlying support structures, and a rhinoplasty procedure is ultimately the chef's kiss in changing or removing this feature. Number four, a nasal tip that is bulbous, hanging, upturned, uneven, or tilted. Abnormalities to the nasal tip are an extremely popular request for improvement. There is a fear of getting a pinched nasal tip that was often the result of rhinoplasties performed in the 80s or over the years. Techniques have advanced and been refined so that a surgeon's goal is to refine and define the nasal tip, but keep adequate support so as to avoid that pinched appearance and issues with nasal patency or breathing. Number five, nostrils that are wide, flared, pinched, or uneven. The nostril shape and position can greatly affect breathing and appearance. Establishing nostril symmetry and function are a crucial focus of the rhinoplasty procedure as a whole. It is important to remember that nostrils will never be exactly symmetric, even with surgery, although we can often get very, very close. Think of them not as twins, but as sisters or brothers. Number six, difficulty breathing through the nose. Breathing is an extremely important aspect of one's life. If you think about it, if you can't breathe, it directly affects your sleep and physical ability to move or work out, which in turn directly affects your productivity, focus, efficiency, and just overall well-being. A rhinoplasty procedure can correct a deviated septum and a narrowed airway passage permanently, getting you back to a life full speed ahead. Number seven, mental awareness. Mental health and stability are huge factors in determining rhinoplasty candidacy. It's important for me to understand why a patient is seeking a change in his or her physical appearance in order to determine if he or she qualifies for a procedure. And rhinoplasty procedures, especially revision cases, are notorious for having unrealistic expectations as a goal of surgery. In addition, the body will continue to age and change over time, and so will your nose. Those with unrealistic expectations of surgery, those under pressure to have surgery by a relative or significant other, those who are struggling with their mental and emotional health, and those who believe the procedure will solve a failing portion of their life do not qualify for this procedure. Now, if this procedure interests you, I encourage you to watch my other videos on facial aging, treatment options, and recovery. And as always, we know that personal transformation is one of life's most meaningful journeys. And at Givens Facial Plastic Surgery, we offer a comprehensive, customized approach designed to reveal unrivaled yet natural aesthetic results for those who refuse to settle for anything less than the very best. Thank you for watching. You can find all of my office's contact information and social media platforms below this video on my channel. Don't forget to subscribe, and I'll see you soon.